Hi guys, it's Dana and this is the topic to my project, Cauti. Urinary catheterization is a common healthcare intervention used to manage urinary dysfunction that poses serious associated risk and complications. Urinary catheters are primarily used to manage urinary problems, namely urinary incontinence and urinary retention. The cause of urinary dysfunction determines the need for either short or long-term catheterization. To ensure the best patient outcomes and minimal complications, healthcare providers should stay informed about urinary care. Attention must be paid to the most likely complications associated with catheter use. Catheter-acquired UTIs is currently one of the most common infections and comprises 40% of all institutional acquired infections and is a main issue of hospitals as it falls under the hospital acquired infection rule. Cautis are caused by bacteria being introduced to the bladder either through improper insertion or care. If an infection is acquired from an institute, the insurance will not pay out, then the hospital is responsible for the treatment. Catheters should now only be used when necessary and removed as soon as possible. Patients identified as being at high risk for Cauti should be carefully monitored. Risk factors of developing Cauti include female sex, older age, prolonged catheterization, impaired immunity, and a lack of antimicrobial exposure. UTIs are painful for anyone, but the elderly are more susceptible. You can also become septic from a UTI, which is also more common with the elderly. Older patients with indwelling catheters may not present with the typical signs and symptoms of infection. Change in mental status may be symptomatic of Cauti. Urinary tract infections are the fourth most common healthcare acquired infection and account for more than 12% of acute care infections and 30 to 40% of infections in the healthcare setting. Each day, an indwelling catheter remains in place, increases the patient's risk for developing a UTI by 3 to 7%. To minimize the potential for introduction of microorganisms into the bladder, urinary catheters should only be inserted by properly trained individuals. Hand hygiene is the most important means of preventing infection and should be performed immediately before and after insertion or any manipulation of the catheter device or site. Indwelling catheters should be inserted using aseptic technique and sterile equipment. The equipment needed for insertion includes sterile gloves, drapes, sponges, and appropriate antiseptic or sterile solution for periurethral cleansing, and a single-use packet of lubricant jelly. Catheter care involves regular assessment and inspection to evaluate the integrity of the site and monitor for infection. The patient and catheter should be cleaned regularly, and the tubing and external collection bag should be changed when required. Hand hygiene should always be performed before and after catheter care is done. The catheter drainage system should remain closed at all times when it is not being drained, and always kept or hung below the patient to prevent backflow. Always inspect the tubing for kinks and obstruction, as this can cause backflow as well. The collection bag should be emptied when full or at least every 8 hours to prevent migration of bacteria. Catheterization should only be undertaken when all other methods of urinary system management have been deemed inappropriate or failed to prevent Cauti. And this is my project. Thank you.